Communication and athletic education skills for the athletic trainer. Communication and athlete education skills for the athletic trainer. Some of the things I would like you to get out of this lecture are to identify key components in the interpersonal communication process, being able to identify mechanisms of nonverbal communication, identifying methods of developing rapport with athletes both pre-injury and post-injury, being able to describe why injury education is important for healing outcomes following sports injury, describing relevant injury-related information that must be communicated to athletes, identifying the importance of a fully developed communication skill set, recognizing the importance of communication and education strategies throughout the injury process, and effective communication and education skills to engage the athlete in psychosocial strategies, and finally, implementing communication and educational strategies designed to enhance the effectiveness of all other psychosocial intervention techniques. We want to develop a holistically trained athletic trainer. Athletic trainers must be able to communicate with and educate patients to put patients at ease, help identify symptoms, translate complex medical information into layperson terms, and be able to translate complex medical information into terms that various types of patients can understand easily. A holistically trained athletic trainer takes the complete athlete into consideration from a biopsychosocial perspective. Let's talk about the communication process. Communication is integral to our daily lives and is a critical element in sport and physical activity. In many situations, it's not what you know, but how well you can communicate information to others. Good communication skills are among the most important ingredients contributing to the performance enhancement and personal growth of sport and exercise participants. To be a successful sport and exercise professional or athletic trainer, you must develop strong communication skills. The basic communication process. There is a sender and a receiver. The sender has a message which becomes encoded. The receiver has to decode the message and then provides feedback. Within this process, there is also what is called noise that can disrupt the process. Noise can distort the message and make communication less effective. One-way versus two-way communication. In one-way communication, information flows in only one direction. In two-way communication, one person sends a message while the other engages in listening and attending skills. There are two basic ways to communicate, interpersonally and intrapersonally, as well as nonverbal communication. Interpersonal communication involves at least two people and a meaningful exchange. This is what we typically think of as traditional communication. The sender intends to affect the response of a particular person or persons. The message or content may be received by the person for whom it was intended, by persons by whom it was not intended, or both. On occasion, the message may get distorted so that the sender's intended message does not get transmitted as originally intended. Nonverbal communication is sometimes referred to as nonverbal cues. Nonverbal communication is critical to imparting and receiving information. Behavior and elements of speech aside from the words themselves transmit meaning. Nonverbal communication includes pitch, speed, tone, and volume of your voice, as well as gestures and facial expressions, body posture, stance, and proximity to the listener, eye movements and contact, and the dress and appearance of the individual. Intrapersonal communication is sometimes called self-talk. This is the communication we have with ourselves. We talk to ourselves a lot, and this inner dialogue is important. What we say to ourselves usually helps to shape and predict how we act and perform. Self-talk can affect motivation and even concentration. Effective communication can make the difference between success and failure among individuals and teams. Thankfully, effective communication can be taught to coaches, managers, and even athletic trainers. There is a self assessment scale to help individuals increase their self awareness of their communication style, called the Communication Self Evaluation Assessment. People are often unaware of the many nonverbal cues that they use while communicating. It is estimated that nearly 50 to 70% of all information in communication is received through nonverbal communication. Nonverbal messages are less likely to be under conscious control, and therefore they are harder to hide than verbal messages. Nonverbal message characteristics include physical appearance. Our first impression of people often comes from a physical appearance. The way we dress can convey powerful information to others. Athletic trainers need to be careful about imparting information, whether positive or negative, through dress. Posture, how we carry ourselves, our gait, and our posture, also sends messages to others. Someone who shuffles along with their head down and hands in their pocket may convey sadness compared to someone with a bouncy step that may suggest a sense of control and confidence. Body language influences athlete perception of their competitors, especially as you're young and learning to become a professional. Body language can have an important impact on your ability to influence others. Sometimes we call this fake it till you make it. Body position. Body position refers to the personal space between you and others, and to the position of your body with respect to others. Body position is an important aspect of proxemics, which is a study of how people communicate by the way they use their space. Gestures. People's gestures often convey messages, whether you want them to or not. Touching. Touching is a powerful form of nonverbal communication that can be utilized to calm someone or express affection or other feelings dependent upon the situation. We need to be cognizant of sexual harassment when utilizing touch as a communication tool. You must make sure that touching is appropriate and is welcomed by the athlete or patient. Touching should be restricted to public places to minimize any misinterpretation of the meaning of your touching. Facial expressions. Your face is the most expressive part of your body. Eye, con- Eye contact can be vital to expressing feelings. A smile is usually considered a universal form of communication and easily crosses language barriers. Voice characteristics. The sound of a voice can either reinforce or undercut verbal communication. Some say it's not what you say, but how you say it. The voice's quality often betrays true feelings, moods, or even attitudes. Voice characteristics include pitch, either high or low, tempo, which is also known as the speed, the volume, loud or soft, the rhythm or cadence, and the articulation or enunciation. Some important take-home points for sending messages effectively. Nonverbal messages are extremely important. They are harder to hide and consciously control, and they are often an accurate indicator of how a person really feels. As an athletic trainer, you will be placed in a leadership position. There are many guidelines for sending effective verbal and nonverbal messages as a leader. Some important things to keep in mind. For leaders, communication is the foundation for credibility and even respect. Credibility is reflected in members' attitudes about trustworthiness. And trust is linked to the concepts of honesty, integrity, sincerity, and even truthfulness. So, when we talk about the athletic trainer and our coaches in our athletes' lives, we have a leader coach athlete communication. So, what is the big deal with communication? It's very difficult to regain someone's trust once it's broken. Words and nonverbal communication have a huge impact. Words can really hurt. The old phrase, sticks and stones can break my bones, but words will always hurt me, is an extremely true phrase. Once words or gestures are out there, you can't take them back or undo them. So we have to think about the perception that we are putting out into our world. There are some common perception problems that can occur among coaches, athletic trainers, and athletes' communications. There is a significant difference that exists between leaders and follower perceptions of leadership behavior and the situation. Leaders often view situations as more ideal than do followers, and followers often see a bigger difference between what is happening and what they think should be happening. So, how do we work on this? We need to build rapport with our athletes. When an injury occurs, the relationship between an athlete and an athletic trainer becomes one of the athlete's most important connections. Athletes are more likely to listen and adhere to what is suggested or advocated by their athletic trainer if there is a personal relationship that has already been established pre injury. The development of rapport is key to ensuring optimal physical and psychosocial recovery. So, how do we build rapport with our athletes? We want to establish rapport before the injury occurs. There are some common elements to building rapport. There are 4 elements that are often suggested for building rapport with athletes. These 4 principles are empathy, authenticity, similarity, and shared experiences. Some additional elements that have been suggested are checking your appearance, remembering the basics of good communication, finding common ground, creating shared experiences, being empathetic, and mirroring and matching mannerisms and speech appropriately to the situation. We can also develop rapport following an injury. We may not know all of our athletes prior to their injury, so then we have to develop rapport after their injury has occurred. We can do this by helping to support the athlete. We can create an effective communication strategy and help build their confidence and trust. We need to be consistent in our behaviors and be a guiding force for our athletes or patients. Facilitating an accurate understanding of the injury and its associated consequences has a direct effect on the athlete's cognitive appraisal and consequently their emotional behavior reactions following injury. Athletes who are uncertain or lack understanding of their injury often will make inaccurate appraisals of both the demands of the injury situation and their available resources. Quality education of injured athletes is also important because of its relationship to motivation. Many individuals have a difficult time giving optimal effort to something that they do not fully understand or something that is not important to them. If athletes can understand the why behind rehabilitation activities, then they are more motivated to adhere to the rehabilitation program and will hopefully end up with better outcomes. So, how can we deliver educational information? First, break down the educational information into manageable doses. Second, use language that athletes can easily understand. Third, use written material to complement verbal communication. And 4, maintain two-way communication in the educational process. Remember, we need to listen just as much as we speak. We also need to help our athletes by creating and facilitating a positive coping response. When delivering injury information, it is important to send information regarding a diagnosis, prognosis, and even treatment options. This can help our athletes to accept their injuries. To do this, we have to use understandable language. We need to focus on delivering information in a clear and concise manner. If we speak too much, our athletes may tune us out. But we need to make sure that we give athletes the relevant information so that they can make informed decisions. One of these things that we need to educate our athletes about, especially if this is their first injury, is the pain expectation. Injured athletes need to be realistic about the likelihood of pain, both during the injury phase and the recovery phase. Proper communication can help to assist in shaping the athlete's perception of pain and the meaning of the pain. Is there benign pain or is there harmful injury pain? Communicating rehabilitation expectations and efforts that are required. Providing information about what should be expected serves to decrease the athlete's anxiety and answer the unasked questions. To do this, we will provide a clear explanation of the rehabilitation regimen. We need to involve the athlete in the process of goal setting, both short and long term goals. And we need to communicate the expectation that athletes are responsible for their own treatment and ultimately their recovery. Communication during the return to activity process. As the injured athlete prepares to return to sport, they may have a fear of re injury or worry about not regaining their pre injury skill level status. Before an individual is returned to activity, we need to communicate with our athletes about any physical or psychological recovery concerns. Decisions to conclude a rehabilitation and return to sport should not be underestimated. Communication with athletes about their feelings regarding return to play is extremely important. Think about who needs to be involved in the communication of returning an individual to participation. Some individuals are vital to keep in the loop, while others are on a need to know basis. What communication do we have with our physicians? What about parents or family members, or even the coaching staff?